Yeah, hello. Can everybody hear me?
Yes.
Okay. Hi, everyone. Very excited to see you all this afternoon and to show off some of the wonderful work that's happened under theme one of Mobilizing Justice. And this is the case studies research. So my name is Leah Ravensbergen. I'm an assistant professor at McMaster University, and I co-lead theme one, which is prioritizing populations with Jean-François Quentin from ARTM, who I saw recently, and hopefully he's still here. The case studies is a really interesting and unique research opportunity that's run by Mobilizing Justice. The goal of these case studies is to identify the needs of populations that are underserved by existing transportation systems. And it's an emphasis on people who are often less likely to respond to things like the wonderful travel survey that Catherine Mohanty presented about this morning. So it's about getting in-depth and nuanced understandings of those harder to reach populations. And what's great about the case studies researchers is that they all work in partnership with community organizations of some kind and do community engaged research. So we have these really interesting pan-Canadian in-depth community-based projects that we get to show off with you today. Last year we had our last academic year, we had an open funding call for people who did this kind of work across Canada. And we had an application that was assessed by myself and the other theme lead, and as well as another academic member of Mobilizing Justice and a seat member from the Community and Equity Advisory Table of Mobilizing Justice. And we were lucky enough to fund 7 really exciting projects. They're all at various phases of occurring right now, and hopefully we'll have reports to share with you all soon. But today we have 4 researchers and 3 case studies that are wrapping up their projects and are going to do short presentations, about 8 minutes each, on what they did and what they found. We'll have about 2 minutes for questions after each presentation, and then we'll have lots of time for questions and discussions at the end. What all of these projects have in common, because you'll see they're about different populations across the whole country, is that they're all community-based and they're all on specific populations. So hopefully we'll get some insights across the projects on best practices around community-based research and what's good about this approach when it comes to transport justice. So without further ado, our first presenter is Dr. Jacob Alhassan, who is welcome to start setting up his slides if he has some. There you are. Hi, Jacob. And I'll introduce you as you do that. So Jacob is an assistant professor in the Department of Community Health and Epidemiology in the College of Medicine at the University of Saskatchewan. And today he'll be presenting the promise and perils of a free rural transportation scheme in Northern Saskatchewan. Thanks, Jacob.
Yeah, thank you so much, Leah. I'm going to try to quickly go through these slides. And thank you to everyone for participating in this symposium. I'm presenting on behalf of myself and Dr. Daniel Fuller, who is an associate professor in our department, and I'm going to be sharing about a free transportation scheme that was started in Saskatchewan just a couple of years ago. And some of the lessons we've learned about the challenges of running that service, but also the opportunities in terms of what it has done for people. So I'm going to start by acknowledging that most of the research that I have done and that I'm presenting today to you was conducted on Treaty 6 territory and the homeland of the Métis, and I pay my respects to the First Nations and Métis ancestors of this land. And through my research and the work that I do, I hope that it's a way of reaffirming our relationships with one another. So I'm going to talk briefly about transport as a social determinant of health, and then move through how Saskatchewan has lost intercity transportation and why this project was conducted and kind of what we've learned in the process. So transport is one of the most important social determinants of health. It affects people's ability to access care. It affects people's incomes, their ability to get to jobs and things like that. But it also affects health through motor vehicle accidents, physical activity patterns, which then translates into obesity and diabetes patterns. And so, I know that much of this is preaching to the choir, but in the Saskatchewan context, where most of the work that I'm about to talk about took place, a very important event occurred in 2017 when the main intercity transportation system in the province was shut down by the government as part of austerity measures. The idea was that the company wasn't making enough money. The number of people using the bus were not, plenty enough, and things like that. So the government has shut it down and had said that private sector operators would step in. And, we haven't really seen that happen, but we have seen communities rising to the occasion and trying to come up with solutions of their own to respond to the transport vacuum. So just to put it in context, I'm in Saskatoon right now. And to go 4 hours up north, where most of the research I'm talking about occurred, there is no way to do that. There's no publicly funded way of doing that. So if you don't have a buddy or anything like that, then there's no way to get there because you don't have even like taxi cabs that would do that. There's just no way. So it's like this very big mobility vacuum that we experience in our province. So the Kikinak free bus service, which is most of what I'm talking about today, was started by an indigenous community-based organization called the Kikinak Friendship Center in La Ronge. So La Ronge is 4 hours north of Saskatoon. And the service was started because in the context of the pandemic, there were so many challenges faced by community members trying to access services. And the Friendship Center had bought these buses, a few buses in the past, so completely unrelated to the pandemic. And so they got access to some funds and decided to trial a free bus service to see what would happen in terms of who would ride the bus, where would it go, and things like that. And so the funding they got was for a year. And they ran out of that funding and then applied and got some funding again for another year. And as I speak to you, the service is not running because they ran out of funds. And Leah and other people on the case study sort of team have had conversations with me where I've shared about some of the frustrations of trying to do this work in the in a context where you don't know if there'll be a bus that you're trying to evaluate in the next month or so. So I'm going to share mostly about data that we collected by interviewing bus riders, so 32 in number, and 6 interviews that we conducted with program administrators, so the drivers, the guy who got the money to run the service, Ron Wojtowicz, who is now retired, as well as people who actually scheduled, the rides. We also have data from 7 conversation circles that we had with people whose clients benefit from the service, as well as some quantitative data on actual person trips. So we have most of what I'm going to say is based on 1,185 person trips, but there is an update to the data. So the total data we have would be for 2,346 person trips. So the first thing we learned was that, in terms of gender, the bus service benefited women more. So 53% of those who rode the bus were women compared to men. And you'll see, I'm sure people might be wondering, what is adult, what is child, what is elder, what's the age group we're talking about? For the most part, we partnered with the partners to collect this data whenever people would call to schedule a ride. And so that was the kind of data we could collect. We couldn't ask people to give actual birth dates. In terms of what people use the bus for, we learned that majority of it was for visits, as you can see, this 61%. And then the second big one would be traveling to medical appointments. And interestingly, most people use the bus for one-way trips rather than return trips, which might be because the population is transient. It might be because people are using the ride to visit family and not necessarily come back that same day, etc. So it's a huge, discrepancy when you look at the number of trips in terms of how many are going one way and how many are coming back the same day. We did some basic chi-square analysis to see, male-female differences. And, there were some differences, but most of them were not statistically significant. So if you look here, the one that was significant was that men use the bus more for work purposes compared to women. But you see these differences. So women use it more for visits than men, but it's not statistically significant. Same thing for medical, more women than men, but not statistically significant. In terms of age differences, there were some statistically significant differences. Elders tended to use the bus more for medical purposes than adults, and then children less than adults. And in terms of shopping, adults more than elders, and then adults more than children. But again, you can see here that there are some differences, but they're just not statistically significant. In terms of First Nation status, which was an interesting element in our research, we didn't see any statistically significant differences in terms of usage of the bus for the different reasons, which is kind of interesting because unlike non-status First Nations people who pretty much don't have any option for travel, First Nations people are supposed to have access through medical transportation on their band, but they still used it pretty much the same way as people who don't have that. So it obviously raises lots of questions about whether the services that they actually have on the reserve, to provide transportation for medical is enough. If it was, people probably wouldn't be using this service as much as they are using it. The qualitative data showed that people use the bus for all kinds of reasons because of their inability to drive, because of accessing resources to fulfill responsibilities, because it was the best option available, and also because they wanted to be able to maintain social networks. And I'm just wrapping up here. There are lots of things we learned from the qualitative data. The first big one is that it improved access to medical care. So people use the bus to escort family members to go for appointments. And this is a story of a grandmother who is talking about her grandson who uses the bus to escort his mother to attend hospital because of a chronic condition. And for older people, they often really talked about social participation and mobility. And one participant talked about the bus as a godsend, as you can see in this quote. In terms of the challenges, the biggest thing was funding, as I have said many times from the beginning. At the time that this interview was conducted, the bus had stopped running temporarily, and the operator was saying, if I had money today, I would immediately restart the service. And so that has been a big challenge. The other one is that because it's a kind of small town sort of context, it's very difficult to find drivers and people to actually run the service. And so that's why it's kind of difficult to keep the service going. And so basically when they ride from one point to another, the driver has to stay there for like a 12-hour extra period and be paid for that because there is no way of arranging things for people to ride the bus and have the driver return immediately so that you don't have to pay them for the whole time. So just wrapping up here, I think most of the evidence that we have shows that the free transport system or this free transport service is a critical resource that can make a huge difference in rural communities, and the collaborations are needed to allow better mobility basically for people in rural and remote sort of contexts. And I want to thank lots of people. You can see a big list there. Those from the Friendship Center and my colleagues at the university, as well as a number of students and my colleagues from the MJ team, as well as Leah for all the conversations that we have had. Thanks.
Thank you so much. I know that is hard to cover in such a short amount of time, but really, really fascinating work. And I love that this also exemplifies what's happening with the case studies, where it's not only community-based, we've got some mixed methods happening. Do we have any questions from the room just for a minute or two before we go move on to the next speaker? We can put them in the chat. I can start off by asking Jacob whether he thinks that continuing to fund these buses is the solution, or if it's more of a question of returning the old bus program, or how do you feel about this solution in general? Because it's always challenging when the core issue might not even be responded to through these community bus programs. And I'll keep an eye on the chat while you respond.
Yeah, I think the broader long-term solution would be to come up with a bus service system that would serve the entire province, because this mobile, this sort of free transport thing is really cool in terms of what it has done, but it just serves two communities. The previous bus service served over 250 communities, so it's a huge difference in terms of the level of coverage. And I think as well, maybe it's just an opportunity for us to reconceptualize transportation and think of it more as a human right, and collaborate to provide access to transportation, particularly for people in vulnerable sort of contexts. So I think if we could bring that bus back, that would be awesome, but it'll be very, very difficult. The bus was established in 1946, and so it'll take a lot to bring it back.
Well, on that positive note, I'd like to thank you. I'm sure people have more questions that we'll save for the end. And I'll introduce our next case study researcher. This is Dr. Zahra Tavakoli, who graduated since beginning her case study. So we're very proud of her. She's a researcher now in the Department of Civil, Geological, and Mining Engineering at Polytechnique, Montreal. And her presentation is on an equity analysis of children's accessibility.
Thank you, Leah. I'm looking for an option to see if I can share, because I have some notes on my presentation. So I'm looking to, is there an option here? Because I'm not really familiar with Zoom.
Yeah, for sure. So there's a share button with the green arrow. If you click on it, you'll be able to share your screen.
Okay, no, because I have some notes on it, but I was wondering if that's the case. All right. So you can see my screen right now?
Yes, we can.
Perfect, thank you. So hello everyone, it's a pleasure to present my research about the community analysis of children's accessibility, which is based on the results and analysis of a diagnostic tool to measure children's walking accessibility that I did during my PhD. So why this topic is important? Well, mainly because in terms of equity, children's mobility and their travel pattern are kind of overlooked as current transportation planning system is prioritizing the needs of working adults by using various adult-centric metrics, which resulted in increasing car dependency among children, change their travel behavior, and reduce children's accessibility, which adversely affects children's psychological, cognitive, social, and physical health. And it would be extremely important to create more accessible environment to promote children's mobility, which contribute to their overall health and well-being. So what do we suggest? We suggest a tool to evaluate the quality of neighborhoods based on children's needs according to different criteria, like identifying children's destinations, the network that they can facilitate their travel, and of course, measuring their level of accessibility. So the main research question would be how to measure children's accessibility and how could this walking accessibility to different destinations could support children's health and well-being. Here is like the list of the destinations that list of the publications that we did during my PhD, and of course I will explain for each step, but like as a complete an overview of the whole methodology, we started with characterizing the child-friendly transport infrastructure, meaning that identify which street is safe for children to travel. We went through a comprehensive methodology to identify the relevant destinations and walking distance threshold with respect to children's need. According to those two, we generate accessibility indicators for children. We identify how different destinations could support children's health and well-being, and we try to improve our results by designing different surveys. So as a first step to identify the traffic danger penalty on each segment, we calculate the traffic danger score on each segment based on measuring the relative importance of different traffic danger indicators like speed limit, road class, different traffic calming measures compared to another. And then we classified those from the score 1, which is very safe, to a score 4, which is very dangerous. And in the case of city of Montreal, for example, you can see the dark red, which is the highways or main arterial roads are the most dangerous one, but the walkable neighborhoods, which are in the light blue, are regarded as the most safest part. However, this process has been improved, and my colleague Shabnam will explain about that. The next part would be about identifying the relevant destinations and threshold. We first started the scoping review. A lot of studies about children mostly refer to going to the schools or parks, but we believe that it's beyond that. Of course, they are important, but we believe to work more on the non-school destinations. So we went through the scoping review, but also we started an extensive methodology of focus group discussions with children, with parents, and with experts, with two main questions to understand first how children go, where children go, and how those destinations could support their health and well-being. The results was kind of fascinating in terms of identifying different perspectives from these communities. For example, the first part was parents mostly refer to community centers, after-school programs, daycares, schools, libraries that are likely most formal places. But from the children perspective, they mentioned a lot of informal, but mostly happening through the nature or green spaces like a tree in the park, beach, forbidden yard, biking in the neighborhoods or playing in the back alleys. And also experts who were mostly referred to like the cognitive or well-being destinations, which were mostly about like the informal places to explore. So these kind of resulted highlighted the importance of leisure destinations, but also reflect how much children's perspective could matter. And it also helped us to design much more targeted survey in the future. The next part was about generating walking accessibility by using the cumulative measure, by using the centroid of each each dissemination area from the city of Montreal from the walking distance of 1,000 meters in two scenarios. This is the first scenario, which you don't use like the penalty scores and in the situation that a normal adult can reach. But when you apply the traffic danger score, you can see that how much this area could be shrink, and you can imagine how much the number of the destinations that children can reach could be shrink. We identified 7 different categories of destinations, around 122 different types of destinations that children can go based on the focus groups and also based on the scoping review that we did. And here it is the result of the accessibility, for example, for the category of leisure destinations. In the downtown of the Montreal, where we have like much more walkable neighborhoods, we have like the maximum number of the accessibility destinations for this category, which would be around 386. But after applying the traffic danger score, you can see that how much this number of destinations could drop to like 175, which was something like really significant. Also, in the peripheral boroughs, we have like less accessibility, mostly for 2 main reasons. Either there are like much more dangerous high-speed or arterial road, or also because these are like much more residential places, so there are less opportunities to go. And the last part was about how different destinations could be related to different well-being dimensions. We went through like a literature review to understand what well-being dimension means, how it could be like impacted children's travel. And then we started like different surveys with parents, with children, in order to identify like an agreement methodology that how these destinations could support them. We add a weighting system on each destination. And again, we calculated the cumulative measure. This is an example for the physical low intensity before applying the traffic danger and after. Again, the results are kind of significant. And also we went for like different measures. This is for social health, having social interactions with children before and after applying the traffic danger. So in terms of equity, one could consider that research that examines how children's travel in general could be limited compared to what adults could experience. However, we went through like some socioeconomic studies to understand how does accessibility by well-being domain measures could vary by different income quantiles. So we went through like different bivariate analysis. For example, the between the income and between the accessibility. Here is a sample for the low intensity physical activity, and the dark red shows that the places, the DAs where we have like the highest income and again, highest accessibility. So you can see, for example, again, in the most walkable neighborhoods in Montreal, we have like the highest level for both. We also conducted some t-tests comparing like the lowest income quantile to other quantile to analyze the accessibility to well-being destinations. In the case of Montreal, we found that lower income quantile households with children generally have like highest accessibility compared to like the ones in the higher income quantiles. This has like could have like many different reasons, but one could be related to the fact that older neighborhoods were built before current zoning laws and car-oriented developments have like more apartment, maybe they are older, they have lower values, but on the other hand, the more walkable neighborhoods, which are like the rent are kind of highest, could make impact. So this could be like an exchange between the households in terms of accessibility, low transport costs, and also high residential costs. And in conclusion, we demonstrated that how accessibility to different amenities can be significantly impacted by limitations because of the traffic danger when it comes to reaching for children to meaningful destinations. It reflects to what extent different categories of destinations could support multiple aspects of well-being with the perception of parents and children. It emphasized the importance of different inputs, specifically for children when it comes kind of matters how the results could be different. And we believe the systematic nature of this analysis suggests that similar methodology may be adopted and applied in other contexts. And that's all. Thank you very much.
Great, thank you. Again, so much important work to try to cover in 8 minutes, but thanks for going through all of that. I really like seeing the different considerations you need to have when you're thinking of children's needs in cities rather than the assumed adult. And children, of course, are less likely to respond to surveys. Do we have any? I don't see any questions in the chat, so I'm just going to move on because we're also running slightly behind, but hopefully we'll have some at the end of the period for everybody to respond to. And our next person is also part of the same dream team from Polytechnique. We get 2 presentations for one. This was part of the same case study, but we got 2 really wonderful researchers working on this project. So our next speaker is Shabnam Abdollahi, who's also recently finished her PhD. So we have another graduate presenting today, and she is now a postdoctoral researcher in the Department of Civil, Geological, and Mining Engineering at Polytechnique, Montreal. And her presentation, and feel free to start sharing if you'd like, Shabnam, is on equity analysis. So again, focusing on children in Montreal, but this time looking at traffic hazard analysis. Thanks.
Thank you very much. I try to share my screen. Can you see my screen?
Yes.
Yeah, it looks great.
Okay, good. Hello, everyone, and thank you very much for being us today. And thanks, Love, for the time that provide for us to present our project. My name is Shabnam Abdollahi, and my project is about equity analysis of children transferred traffic hazards, which is part of CHIME project. First of all, we need to know why is traffic hazard. In the definition, hazard is any condition, object, or situation that pose a risk to people's safety and well-being, which even if the harm has not yet occurred. As an example for this, hazard could be the electrical post that is a hazard, and we use some kinds of signs and we block it, and we want to people know that is so harmful for them. In terms of dangerous styles, they also have the potential to cause severe injuries and fatalities. So therefore, they're all hazards to public health. But since there are the public place that people need to access them in their daily life, we cannot block them. So if we want a way to identify and prioritize them for safety intervention, we can reduce the hazards. For traffic hazard, we can say that it's a very complex issue. There are many different considerations regarding the hazards, traffic characteristics, design characteristics, and behavioral factors, and so many other different factors, which when we consider traffic danger, they are all different weighting. And also we have different groups of stakeholders involving in traffic danger. They may be engineers, public health expertise, planners, and also different groups of users. So if we want to have the more accurate traffic danger assessment tool, we need to involve the different stakeholders' idea and also waiting for the different factors. Our solution for assessment of traffic hazards is multi-criteria decision aiding approach, which help us first to provide a score for each of the criteria that we want to consider in traffic danger. We can find the importance of each criteria. In terms of stakeholders engagement, MCDA help us to facilitate the direct participation of different parties and also help them to reach the agreement and consistency, even they have diverse perspective. And also since the stakeholders are involved in the process of developing a tool, these tools can be more transparent. An overview of methodology can be seen here. I removed lots of details, but if you want to know more about the project, I can share with you for sure. We start with structuring. In this part, we have some kinds of online focus group discussion with different groups of stakeholders to find what is the important factors influence on traffic danger. We have 3 different meetings with the expert, with different expertise from Quebec Canada and US. We also have one meeting with children who are the vulnerable group with their level of experience, and because of their side, they may be more vulnerable in traffic danger. And also we have had some meeting with the parents in both English and French. Then we went through the evaluation part. For evaluation, first we defined the cardinal scales for each criteria. It means that we need to interpret the relationship between different levels of each criteria with traffic hazards. And we weight the criteria. We wanted to know how much does each criteria contribute to overall traffic danger scores. For this step, we had a different workshop with a group of experts with different expertise, and they help us to develop these steps. And finally, after having lots of spatial analysis work and preparing the results, we validate the results again with the groups of experts in the 4 workshops. And we ask them to rank a random segment and intersection, and we compare the model ranking with expert assessment, and hopefully we validated our result with high correlation. I just put some criteria from the segment model that we have. You can see what factors we analyzed during this process. All these factors came from the idea of stakeholder groups, and we consider the relationship between different factors when we add them to the model. For example, you can see there for traffic characteristic, we combine speed limits, street direction, traffic volume, and number of lane as one criteria. It means that these factors have some interaction together when we consider traffic danger. And you can see an overview of study area. We limited to some borough in City of Montreal because of data availability. And I put an overview of 2 models that we have. For each street segment and intersection, we can have a score. To be more understandable, we classify these scores in 5 different levels, starting from safe to very dangerous. And you can see how these different levels distributed in the City of Montreal. In terms of equity analysis, we consider different literature to find which factors we need to consider. The first one is a children's population that we consider in our model. For children population, we use the children density as a measure, and also for danger rate, we use traffic hazard rate, which is the proportion of dangerous road segment in each DA. Also, we went through the analysis of income. For income, as a measure, we use the median household income for families with children. The quintile 1 is the lowest income, and the quintile 5 is the highest income. And you can see how, and also we have the danger rate starting from high to low. The red one is the places is sensitive when we consider both income and danger rate. Another important point is that we want to prioritize the intervention for safety. So where we need to start first, we need to combine many different factors. These 3 maps could be some examples of the factors that we need to consider, but if we want to combine them to have one score for prioritizing the intersection or segments, we need to consider the importance of them as well. So we believe that prioritizing tool for safety intervention could be another MCDA approach that we need to consider different level of criteria, identifying criteria as well as first, and then defining the different level for criteria and weighting the criteria, which needs another process to do. During this project, we had different partners that help us very much during this process. The first role that they have is they actively participated in a focus group discussion. In some cases, they help us to find the participants specifically for children group. Also, they help us in development of tools in participating in workshop in weighting criteria, and also in some cases, they facilitate or access to the data. We want to continue our collaboration. We want to continue working, especially with the city of Montreal, to validate and refine the traffic danger tools. We want to also extend our tool to other vulnerable groups, such as elderly group and groups with specific disabilities, alongside with children. And also another partnership that we have is for intersection prioritization tools for safety intervention. In conclusion, we have effective, transparent framework for evaluating traffic danger that improved by stakeholder engagement. And we believe that this application could be adaptable for other neighborhood and other cities. There may be some changes in specific areas, but we can have it for other places. Thank you very much.
Yeah, thank you so much. I'm going to just ask you a quick question before we move on to our last speaker. I really love that you're talking to children and experts and parents. It must be quite a whirlwind for both you and Zahra to jump between those worlds. Any big insights on how they differ? Like what different insight do you get, or what different vibes do these groups give you? Why is it important to do all three?
Interesting question. Actually, at first for children, because I think we rarely ask children about some specific aspects of transport, but children talk very clearly without thinking about anything, and they mentioned many different and interesting points, and they help us a lot during this process. For example, when we talk about the traffic characteristic, expert may just mention the speed and other things, but they mentioned some details based on their experience, which is so real. So I think that's the process that we need to go through, and we believe that many different type of transport project could be all MCDA, because we need to have some kinds of engagement with different stakeholders, with different users, to have more acceptable and realistic models.
Awesome. Thanks so much. I'd love to keep going, but let's do our last presenter before we open it up to everyone. Know if you want to get your slides up. So we were in Saskatchewan, rural Saskatchewan, then we were in Montreal. Now we're going to Toronto. This is Noah Kelly, who's going to be presenting on transport equity policies for people experiencing homelessness in Toronto, current gaps and possible alternatives. Thank you, Noah.
Thank you. As Leah said, my name is Noah Kelly. I am a master's student at McGill University, as well as one of the co-founders of the Transit Access Project. We are a nonprofit organization that researches and advocates for transportation equity programs for people experiencing homelessness in Toronto. And today I'm going to talk about one of two case studies that we have partnered with Mobilizing Justice to conduct, which is a survey of transportation support resources for people experiencing homelessness in Toronto. So to start, what is the relationship between transportation and homelessness? What is the importance of transportation for people experiencing homelessness? So previous research has shown that lack of access to public transportation can be a significant barrier in the process of rehousing, because a lack of access to public transportation can mean a lack of access to supports and opportunities outside of a walking range. So that means a lack of ability to maintain quality of life and a lack of ability to access essential destinations that can aid in the process of rehousing. A lack of ability to afford to ride the bus or afford to ride public transportation, but also a need to access those essential destinations, can also require one to evade fare, leading to vulnerability to criminalization and harassment. And if you have to take public transportation and want to avoid that vulnerability, but have a limited ability to pay for your essential needs, it means that you have to sacrifice your ability to pay for other essentials, such as food and housing, to be able to afford public transportation. So in Toronto, there is one fare equity program citywide, which is the Fare Pass Transit Discount Program, which is a fare geared to income program for low-income people and people enrolled in specific government programs. This program brings the regular cost of a single fare to $2.10 and a monthly pass to $123.25. But in conducting previous research, we saw that the cost of even this $2.10 individual fare was still too much for many people experiencing homelessness. And so we wanted to look into what other supports are available to allow people experiencing homelessness to access public transportation in Toronto. The only other supports that are available are transportation resources offered by service providers, social service providers within Toronto. So this would be ride shares, taxi chits, Presto tickets, monthly passes. There's a variety of supports that can be available. It also includes bikes offered by service providers or rides in organization vehicles. But for shelters, the Toronto Shelter Standards only requires that shelters provide transportation for referrals and transfers. So there's no guarantee of funding for all other transportation supports. This means that transportation supports offered by shelters are highly variable between individual organizations. And so we wanted to assess this variability between individual shelters and then also across all service types that people experiencing homelessness could be accessing in their day-to-day lives to see what transportation supports are available in this range of services. So we decided to conduct a survey of service providers in Toronto, with the research questions being what types and what amount of transportation supports are offered at Toronto social service providers, and how much is being spent on these supports by service providers, and where is this money coming from? How are these supports being funded? And then are these supports that are currently available sufficient in meeting clients' mobility needs? So to conduct this project, we partnered with a whole bunch of organizations, all falling into 5 different sectors, being shelters, drop-ins, newcomer organizations, supportive housing, and violence against women organizations. This is the list of all of them. I'm not going to read them all out, but they were all generous enough to lend us their time to participate in this study. And we ended up distributing our surveys through Qualtrics through these coordinating networks to individual service providers, to frontline employees of these service providers. And we got a total of 178 responses from service providers. And here's what we found. So here's the proportion of organizations in each of these 5 sectors that were offering any kind of transportation supports to clients. So this ranged from 46% within the supportive housing sector to 67% within shelters, which was the high across all sectors. But then this isn't very descriptive. What are these supports actually? This is just like you could be offering a single pass per year and be included in this count. So to get more detailed here, these are the resources, the 2 most common resources offered by each sector. So we were very surprised to see that ride shares were among VAW organizations and shelters the most commonly offered support to clients of these organizations. But overall, across all sectors, single ride Presto tickets were the most commonly offered by organizations. But then again, these aren't the only supports that can be offered. There were also organizations that could be offering things like even monthly passes or credits on a rideshare program. And so it's really hard to calculate the cost of these supports, support by support, because not all organizations had the same supports. Not all organizations were offering the supports that the others were offering. And so we normalized the value of these supports into one number, which was annual transportation spending per client per year for each organization, and then looked at the distribution of this spending across all sectors. And so I'll start with shelters, which is in the middle here. Shelters had a median annual transportation spending per client per year around $50. $40 per year is one individual Presto pass being provided to each client per month. So one ticket per month being provided to each client. So To us, we thought that's not a lot. $50 is just slightly above that. And so, and for organizations like drop-ins and supportive housing organizations, they don't have the ability to even offer one pass per month to clients that are walking through their doors. And so that was different when it came to newcomer organizations, local immigration partnerships, where this number was a lot higher. There was a higher volume of individual Presto tickets that were being provided. So $200 per year per client is around 5 passes per month being distributed to each individual client for the LIPS. And then VAW organizations were incredibly variable in the spending that they were able to offer to clients, with some organizations offering clients monthly passes for the first few months when they entered a shelter to be able to get on their feet and access the services that they needed as they were transitioning out of a dangerous situation, and other organizations not having the funding to offer any supports at all. And so we saw a vast array of supports across these networks, but we generally normatively thought one individual ride per month per client was probably not enough. And then looking at the numbers, we assessed, we asked, what percentage of your clients do you think struggle to access transportation to respondents? And we saw that across nearly all sectors, that number floated around 70%, with newcomer services floating lower at 60%, and VAW organizations above at nearly 90%, which was not surprising to us based on previous research that we've done. But again, there was serious variability between organizations, and we're looking further into this to see if the placement of organizations and their accessibility to different transportation modes may have something to do with this, if the walkability of other services around individual organizations may have something to do with this. But generally, overall, the median value for all sectors was seen to be that service providers didn't believe that their clients had adequate access to transportation. And we asked why that could be. And the reason that was given, predominantly, the top 2 reasons were clients have no income and public transportation is too expensive, with many other answers coming in as well. Things like clients don't feel safe on public transportation. They can't carry their groceries on transportation. They can't bring their kids on public transportation, or it's not physically accessible. But cost was obviously far and beyond the most prohibitive thing when it comes to accessibility to public transportation. And so in conclusion, it's clear to us at this point that the cost of public transportation was a barrier to essential transportation and essential destinations for clients of these organizations, at least through the view of the service providers providing the services at these organizations, and that social services lack the funding to meet the transportation needs of their clients. They see that there's a lack of sufficient supports to meet the mobility needs of clients. And there's a clear gap between the Fair Pass Transit Discount Program and meeting the needs of people experiencing homelessness and people experiencing extreme poverty within Toronto. And the City of Toronto should explore transportation equity programs that reach beyond this transportation equity pass. Anyways, that's my time.
Thank you, Noel. That was great. Very interesting, this idea that the one ride per client per month is way too underfunded. It reminds me a bit of Jacob's talk of these programs being underfunded. And I think sometimes when you do community-based research, you end up working with the very communities who are trying to address transport poverty and really see firsthand some of the funding issues that are making it a lot harder for them to actually address transport poverty. I'm now opening it up. We only have about 8 minutes left, but if we can spotlight all of the wonderful speakers, I'm very happy to take questions from the audience in the chat or directly, but I can kick us off. I'd like to ask you all, for everybody in the audience, you've seen that these case studies fund different methods. We went to different provinces, we did cities, we had rural, lots of different places, very different in many ways, but what they all have in common is that they're focusing on populations that need to be prioritized and that they're all community-based. So they're all working in partnership with community organizations of some kind. And we all know that this kind of work is a lot of work. It requires a lot of relationship building, communication, and knowledge dissemination. So why do we do this extra work? Why is it important? So I want to ask the panel of speakers, just to kick us off, what are the benefits of doing this kind of research? Why do you do it, even if it is more work? So whoever wants to go first, please go for it.
Can take a crack, especially given that I went first. I think, most of the research that I have done up to this point has been informed by a desire for social change. So I think that's actually the underlying motivation for doing this type of work. I think when I have gone to these communities and seen people who are unable to access transportation and hitchhiking in negative 40 degrees and things like that, it's very difficult to do nothing, right? So inaction becomes essentially not an option. And so I think there's a deep-rooted motivation to, collaborate with community partners, as a means of helping to create social change. I would say that's the primary motivation for doing the work we're doing and how we're doing it as well.
Can I continue? In my case, actually, traffic danger is something that people face in their daily life. But in the academic area, we usually use the collision rate when we want to analyze traffic danger. But, when we talk to the people, we found that it's not true. We can have some streets that with no collision, but they are so dangerous that no one can pass through it. So we can say that no collision is safe. In opposite, we can say that having no collision means we can have high level of risk. So when we engage different groups of users and also experts in the process, and also many different community centers, we can have some kinds of more reliable measure for traffic dangers to consider in prioritizing the project, in choosing the intervention, and these kinds of things. So I think having the community and having the users, besides when we consider and analyze different the transport project, can help a lot to have more reliable methods.
Can I continue? So I believe specifically about children's accessibility, a lot of methods that already have done is like, calculating like certain specific destinations, but not like going in depth. But when we are talking about children, the results were really fascinating. Even through the surveys, they helped us to understand the importance of different destinations. When we were asking from parents, they mostly refer to give the highest rank to, for example, to schools. But for children, they had for example, chocolates store, or for example, going to the toy store, the stuff that is from their lens, have one of the most important places in their daily lives. So it brought much more accuracy to the tool in order to understand how different perspective could add different value to different destinations. And I believe that without consulting with children directly, seriously, without going through the focus groups, although it was really difficult to find the reliable parents and children, but without that, it was kind of hard to understand and hard to design the targeted surveys that we have. So I believe that it was one of the most important part of our research.
For myself and our work, I think an interesting dynamic within our research and our advocacy is that there's been a lot of interest by community members and social service providers for the last 15 years to have something done about this issue. But it's always been an off the side of the desk issue for social service providers who are already burnt out and super strapped for time and energy. And so for us, it's really exciting to partner with social service providers, because once they hear someone is interested in this issue and is interested in talking to them about it, they're so willing and able to engage, because they just care about it so much that they themselves in the past have started initiatives around this issue, but it's just not sustainable for them to be, you know, like PhD academics and running social services. And so and also these systems are just so complex. The like intricacy of the relationship between all of these social service systems is incredibly complicated. And so in developing the survey, I spent like 6 months just on calls with social service providers, asking them to explain to me what they do every day. And so we couldn't do it without them. And yeah, we couldn't do it without them.
That's a great note to end on. I'm glad you went last in that question, Noah. I've also got a direct question for you in the chat from Megan Winters, asking if you have any insight about supports beyond public transit, such as bikes, scooters, or so on. Was any of that raised beyond just buses and subways and so on?
I think there was 1 or 2 organizations who offered bikes from their organization, but very few. It was not common by any means. And we didn't collect any qualitative data about those sort of alternative modes. So we didn't get any kind of more detailed, interesting data on that, unfortunately. But I know that there is some interesting research coming out of Vancouver about bicycle use by people experiencing homelessness currently.
Perfect. Well, I think we've only got 1 minute left, so we should probably hand it over to the next team. But I want to thank the 4 presenters here today and for everybody for coming. If you have any further questions, you can always put them in the chat or send the researchers an email directly. I also want to let everyone know that everybody here is going to be writing a policy brief, right? And that will be shared widely through Mobilizing Justice Network. So you'll be able to read that soon enough. And that this is only a fraction of our case studies. We have 3 of our 7, so we have 4 more that hopefully will be presented next year or in the future. And as a final note, we've been meeting frequently and developed a community of practice to talk about the importance of doing this kind of research and some of the challenges of trying to do community-based research. And we hope to have some insights to share with you all. But I'm not going to promise those anytime soon, near the end of the Mobilizing Justice project. So thank you, everyone, and looking forward to the next session.